The mature sperm normally meets the mature egg within the fallopian tube, at which time fertilization may occur. If fertilization occurs, then the pre-implantation embryo continues to develop within the fallopian tube and enters the uterine cavity several days later. The developing embryo then hatches from its overlying shell and adheres and implants into the uterine cavity. The normal events that occur within the female pelvis can be easily disrupted by pelvic adhesions or scar tissue, any stage of endometriosis, blockage of the fallopian tubes, persistent non-functional ovarian cysts, endometrial polyps, or submucosal uterine fibroids. The traditional approach for the treatment of pelvic abnormalities is to identify a problem and treat that problem specifically. This often involves a pelvic evaluation with laparoscopy and hysteroscopy. The primary advantage of this approach is that if a problem can be found and treated effectively, then the couple may have a dramatic increase in their reproductive potential. The more contemporary approach for the treatment of many pelvic factors is to try to go around the problem using in vitro fertilization. This doesn't actually treat pelvic pathology, but can have a high success rate per attempted cycle. A potential downside of jumping to the contemporary approach with in vitro fertilization for many couples exists if IVF is not a covered medical insurance benefit, since it is generally very expensive. Fortunately, surgical repair of pelvic pathology is generally covered by medical insurance.